So let's say the injectable medicines don't even work anymore. What can you do for gentlemen with this problem?
So then
permanent erectile dysfunction.
So a permanent solution would be an inflatable penile prosthesis.
Inflatable penile prosthesis.
That's right.
Tell me more.
Okay. So basically, instead of relying on those two tubes that fill up with blood that we've been talking about, injecting and all that stuff, we put a inflatable cylinder inside that space. We don't remove anything.
You can just insert
it
them
in
right
there
up.
And it fills up with saline or salt water, the same solution as all the cells in your body.
Okay.
It's done through a small incision about an inch long above the base of the penis.
Okay.
Okay. And there's a little pump in the sac between the testicles.
In the scrotum.
In the scrotum.
A little pump.
Little pump.
So if you want to get it up, you just squeeze, you just pump it up.
Pump it up.
And pumps up the jams.
Yep. Just like it's underneath the skin, so nobody could tell that it's in there after you're all healed up. And there's a reservoir behind the pubic bone or underneath the abdominal wall so that all the fluid can go out. So that it's very natural while you're walking around. You can ride a bike, exercise.
Horseback ride.
Yeah. Yeah.
You can do it yourself. And now is there a chance that might get infected?
Yeah, any foreign body, just like if we place your knee or your hip, whatever, there's always a chance of infection. It's very low. All the devices are coated with antibiotics. I do some techniques to help decrease that even further. We usually quote people 1 to 2%. I think it's probably not even that high in somebody without diabetes, but with diabetes, that's what we usually quote them. I always make sure their diabetes is under really good control before I would do the surgery. But we do a lot of diabetics because those are the people that have a lot of vascular disease.
And with an experienced surgeon like you who does a lot of them, complication rates are low.
Yeah. Yep.
Now, is that the state of the art, the pump up kind? Because I know they used to make these kind that would just bend. It was like a permanent erection.
There's something called malleable rods. If you ever seen the gooseneck lamp where you can just kind of bend it, it'll stay. There are a few guys that I'll do that in with just maybe they don't have great manual dexterity or they just want something. They're older, 80. They want something very simple. We'll do it. I don't do a lot because they're just. No reason. You could have more complications from erosion, things like that, because it's a rod pushing on the tissue the whole time.
So the pump up prosthesis is state of the art, and that's what you would want.
Yeah.
Right. I joke about getting a nuclear powered one. So you have to
you should. When you go to meetings, they have all kinds of stuff they're working on, remote controls and.
An app, right?
They had one that
I would like an erection at 10 p.m.
They had this prototype where it would change depending on the temperature. So, like if it was cold, I can't remember if it was hotter, it would get hard, or colder. But you had this wand you were supposed to wave over it. And, there's all kinds of research going on about that.
Amazing.
Yeah. Who you got to argue? If you don't have the ability to pump it up,
you're probably not going to be
don't need it.
you're probably
I guess there are certain situations, but
gotcha.